This section reviews alterations of pulmonary function as they manifest in clinical findings. Here's a little humor to get us started. So you should be familiar with the common patient complaints: dyspnea, which is difficulty breathing; orthopnea, which is difficulty breathing when lying down; cough; aspiration, which is taking material into the airway that doesn't normally belong there; shortness of breath; pleuritic chest pain, which is chest pain which is experienced by the patient when he or she takes a deep breath; and hemoptysis, which is the coughing up of blood. And lots of cases to review. Quick reminder of the difference between a sign and a symptom. A sign is an objective finding, such as a temperature that can be measured or a physical finding that can be revealed. A symptom is something that the patient reports. So in this case, an objective finding would be an oral temperature of 102.4, whereas the symptom would be the patient's complaint that I feel hot or I feel like I have a fever. Listed here are some common signs and symptoms of pulmonary disease: hypoventilation, which leads to hypercapnia; hyperventilation, which leads to hypocapnia; cyanosis, clubbing, and pain. Chest pain, often pleuritic chest pain. Back up to the top, remember that the partial pressure of carbon dioxide is most dependent upon the respiratory rate. And as the respiratory rate goes down, carbon dioxide accumulates in the blood. The partial pressure of carbon dioxide goes up. Remember that carbon dioxide is like an acid when you're looking at acid-base problems. So the accumulation of carbon dioxide, hypercapnia, leads to respiratory acidosis. Cyanosis is a physical finding. It's the bluish discoloration of terminal areas of circulation, such as the lips and the fingertips. Here's what it can look like. Clubbing is a phenomenon that occurs in patients with chronic hypoxemia as a result of chronic respiratory disease. Nobody knows what causes clubbing, but it can be a pretty dramatic finding as represented here. One of the things that you'll see on the left is normally when you put your fingers together like this, you can see a little area called the window where the nail bed hits at a certain angle, that there's a gap, whereas in clubbing that angle is lost, and so the window disappears. All the things listed here are clinical findings in respiratory distress. So you can see that patients get anxious when they're unable to appropriately oxygenate. They show nasal flaring, which is when the nostrils actually enlarge, especially during inspiration. Tachypnea, which is a rapid respiratory rate. And then retractions is when the patient is using accessory muscles to inspire, and so they try to breathe in, and you can actually see the ribs as the muscles between the ribs retract. This is nasal flaring on the right. This is illustrating how you can see retractions in a variety of different areas: and subcostal muscles, substernal muscles, the intercostals, the supraclavicular, suprasternal, and sternal muscles, all the areas in red where you can see retractions, where the skin actually sort of appears to be sucked in as the patient tries to inspire. The definition of respiratory failure includes some clinical findings as well as findings on lab results, but it's the end result of inadequate gas exchange between the alveoli and the blood. It can affect both oxygen tension and carbon dioxide tension. You see a drop in oxygen levels in the blood, which is called hypoxemia, and a rise in carbon dioxide in the blood called hypercapnia. There are a variety of conditions that can cause respiratory failure that are represented here, and you should go over each of them so you're sure you understand why and how they work. So if you go through each of these examples and ask yourself, what's the pathophysiology of respiratory failure in this disease, that will be most helpful. Respiratory failure can also be defined by a blood gas result, although no blood gas should ever be interpreted apart from the clinical information about the patient. But by blood gas results, hypoxemia is a PaO2 less than or equal to 50, whereas hypercapnia is a PaCO2, partial pressure of carbon dioxide, greater than or equal to 50. So it's pretty easy to remember it's 50-50, right? PaO2 less or PaCO2 more. This is a reminder of the complexity of the layers of the thoracic wall, and disruption of any number of these can cause problems in respiration. Chest pain is one of the most common representations of underlying pulmonary disease. So chest pain is not always angina, even though you need to think about angina, because obviously you need to address angina as a possible cause of chest pain, since it can cause significant morbidity and mortality for the patient. But remember too that chest pain can emanate from the lungs, from the pleura, from the airways, from the chest wall. Pleurisy is a condition in which the pleura become inflamed, often from a viral infection. So in the left picture, what you see is a representation on the patient's right lung of the normal pleura, and a representation in the patient's left lung of an infection leading to an inflamed pleura. And because the pleura is inflamed, when the patient tries to take a deep breath, it hurts. This is pleuritic chest pain. Orthopnea and paroxysmal nocturnal dyspnea occur when the patient is in the reclining position. That's obviously usually at night, but it can occur at any time. Patients with significant pulmonary disease will often choose to sleep in a chair that reclines, that can allow them to sit up a little bit, makes their breathing easier. PND is a phenomenon where the patient wakes up suddenly in the middle of the night gasping for air, and can be a representation of underlying heart or lung disease. Cough is a protective mechanism of the body to help the body expel material from the airway. The inability of cough can put the patient at risk for developing pneumonia because they're unable to clear their airways. We define an acute cough of up to 3 weeks. After 3 weeks, it's labeled a chronic cough. This is a reminder of the difference between hemoptysis and hematemesis. Hemoptysis is the expectoration or coughing up of bloody secretions, and this drawing is showing you the various places from where that blood can come. You should look at each of those causes and understand them. In contrast, hemoptysis is not hematemesis. Remember that hematemesis is blood that seems to be coming from the gastrointestinal tract, and this is showing you the various sources from where that can come. We'll go over this obviously in more detail in the gastrointestinal section of the course.